Hi, I'm Dr. Martin Ray. I'm the medical director and owner here at View Laser Skin Rejuvenation in Tsawwassen, British Columbia. I'm here with my patient, Tara, and we're going to talk about a little bit about your journey with therapeutic Botox. She looks amazing and great today, and so happy to have her here. And can you maybe just go back and share a little bit about your story of how you sort of developed headaches? And
Yep. So it started around 1999 with a pretty serious accident. I was a pretty healthy teenager. I was about 17 years old. And then I was trying my best to recover from that. And then I was a pedestrian hit by a car at high speed. And then from then on, I just experienced a lot of days where I had such unbearable pain, so much fatigue. I had to be in a dark room, no stimulus, blinders on my eyes, the room spinning, sound, light, anything. I missed a lot of school. Somehow I managed to graduate, mostly from home in bed. But not a lot of understanding from any of the health practitioners that I saw back then. So I was prescribed so many medications. The side effects of the pain medications were horrific. So anything that would give me maybe like a bit of temporary relief would come with like huge consequences.
you went to a neurologist who
did.
did do therapeutic Botox for you. And what was that experience like?
Let's just say I felt like a number. I was just kind of, not as much of a priority sometimes too with the doctor. And I just didn't feel like comfortable with him.
So it was just your own experience of the service,
Yeah.
the actual treatment that you had.
I felt afterwards funny looking. I felt like this part of like my eyebrows and forehead were just, I don't know. I just felt like
Heavy.
yes, that's the feeling.
Like you see how beautiful your brows are shaped right now?
Yeah.
The vanilla doll.
Yes.
So when you do the standard protocol for therapeutic migraine that we're all taught and the neurologists all follow,
Yeah.
it tends to be 20 units of Botox across here, which means you drop your brow.
Again, it's like being on a medication with a side effect where you're like, okay, like this is helping, but every time I look in the mirror, I feel uncomfortable.
Carol, that's quite the story. I feel for you. And I think maybe let's talk about the day that you came to our open house. I remember your friend. I remember you.
Yeah.
And we did chat just briefly and see.
You're really warm and empathic, and that was also something that was really missing as well in treatment sometimes. Just to know that you could possibly, help me at that time get better, but also have results where I'm feeling confident and I'm not looking weird or looking.
So that was the
weird.
first touch point, at least.
Yeah. Everyone feels like family here to me now, and on the phone or sending an email, it's really convenient and easy.
Thank you for your kind words about my team here and my staff who put a lot of effort into the patient experience from the moment the phone's picked up, making your appointment, coming here, being seen on time. I think, are we usually on time?
Yes. Yeah.
But then also on our first visit, we did quite a comprehensive review of your history and full consultation. We spent about an hour together, I think.
Yeah.
Because I think it's so important to know your patient, because every patient's different. Every patient with migraine has a different story, and you're with post-concussion migraine because you never had migraines before the accident.
That's right.
So we're looking at a post-concussion migraine syndrome. And you had some TMJ problems as well, didn't you?
It's long.
Grinding. Well, that's not part of the migraine protocol.
Yeah.
But when we interview you, I kind of go, okay, well, we're going to treat the masseters for the TMJ, and we follow the headache pattern. And I know that you had some heavy brows, but we don't put the big doses of Botox above your brow because I want you to look great as well as have symptoms that are cleared up. So tell me a little bit about your first treatment and how that impact was for you.
First of all, I just felt like I didn't look funny anymore. So that was also not only having pain relief, being able to look in the mirror and not be like embarrassed of having a frozen brow. That was nice. And I just felt like really positive for the first time and just looking forward to the future, like that there's actually hope that, I could continue to come back and continue to have good results and feel better.
That was after almost 20 years of suffering.
Yeah. There was a long time there where I wasn't able to like go to any of my kids' sporting events. I love watching my son's hockey game, my daughter's soccer games. And for me, especially after that last accident, I was not able to even like focus on where the puck was, where the ball was, without like immediately having to like run out and have to go throw up in the bathroom with vertigo. I don't miss a game now, and that was huge. Also, being able to just like function in public again. So I spent a lot of time like pretty antisocial because when you're, foggy, in pain, dizzy, it's really hard to hold a conversation or feel like yourself around people. So even mental health wise, holy moly, did it make a difference getting the therapeutic Botox. And we've talked about before too, like I felt like it really helps my post-traumatic stress disorder as well.
I remember you coming back after the first period. We saw you 2 weeks later, and I was like, you were looking like a different person. I was like, and that makes my heart this is probably one of my favorite treatments to do. Botox is an amazing drug.
Sure.
It's just not for beauty. It's for function and getting people's lives back. And again, that's for me why I'm still working in many ways, just to help people.
I appreciate it. So thank you.